It's my pleasure now to introduce Professor Bob Pynoos, who's going to talk about innovative protocol and evidence-based interventions with children and families following traumatic events. Bob is again one of the true pioneers in this field, and he is the Professor of Psychiatry at UCLA in the Department of Psychiatry and the co-director of the UCLA Duke University National Centre for Child Traumatic Stress. And he's also the director of the UCLA Trauma Psychiatry Program. Thank you very much, Bob.
Thank you. Actually, I'm going to be doing a little different talk than maybe the title, and maybe a little out of sync with the seriousness of the large-scale disasters and war. But I'd like to give you some insight into some of the new treatments that we've been trying to develop through the National Child Traumatic Stress Network. And one of them is, obviously, America has a lot of troops at war right now, and we've been trying to develop a new way of addressing military families. And I think it's one that actually has been helpful to working with first responder families in disaster zones and even in families in medical settings. And I thought I would give you a sense of how we're trying to develop an actually family-oriented treatment, which I think is a new approach to doing some of this kind of work. And Dr. Saltzman and Dr. Lester are really the primary people, but Bill Beardsley, who's done a lot of work on how to help families respond to depression, actually has been a major contributor as well. In the United States, just to give you an example, I know there are lots of feelings about this particular war and what's happening, but we're fairly devoted to trying to help our military families. There are about 1.2 million school-aged children who have active duty military parents in the United States. That's a huge number of children. There are 35,000 military personnel who have returned home with long-term mental health problems already in the United States and Iraq from what is happening overseas. That's a huge number of fathers, and many of these have young children. There have been over 17,000 military personnel who have been wounded, and these figures are now low. These are 2006 figures, so they're really much higher at this point. But what are the challenges that we know from the literature? Just first, this is very brief, extended separations from a primary caretaker, altered family roles and responsibilities in military families, increased stress on the non-parent military family caretakers, many missed developmental opportunities. Parents are not there during critical stages of the children or adolescents' development. And there's impact of combat exposure on returning parents. Actually, this treatment started just by focusing on the fact that what you had is a family living under danger during the whole time of military deployment. Both the children, the spouse at home, and the parent who's in combat. And that, in fact, the adjustment coming home is one of how to adjust to the issue of having lived under danger for that long, and often the combat soldier bringing back, or Marine bringing back symptoms that were indicative of that level of danger and life threat, which is a very different way to frame actually what to do in terms of a family intervention. And the mental health problems, physical injury and loss that obviously occur in these families. I don't want to go through the previous studies, but the studies have actually rarely been done during wartime, and we actually are doing a very careful assessment of military families and children right now during wartime, which has actually not really been done in the United States before. So I just want to not to go through this literature and more to get to our treatment. We're working at Camp Pendleton. Camp Pendleton is near San Diego, California. It's one of the largest Marine bases in the in America. They've actually suffered over 400 losses at this point of Marines. And the Marines have reported that about 40% of their children are having severe problems, getting into fights, depression, anxiety, anger, hurting or threatening others, or hurting or threatening harm to themselves. So there's actually a very large concern on the military base about how their children are functioning over time. Well, I'm not going to go through these except that you would expect that actually parental emotional distress affects child adjustment, that non-combat traumatic stress in parent and child adjustment are related, and that parental wartime exposure and child adjustment has been known through many studies. And studies have been done in Israel among Vietnam veterans, Holocaust survivors, and the impact on parenting. I just say the parenting style because there's emotional numbing in the parents, not only the military personnel but the spouse at home, difficulty controlling their own aggression, highly authoritarian, and you heard about overprotective parenting styles, decreased monitoring of their children. One of the points that Dr. McFarland brought up about the families that he was studying in the bushfires of the sexual abuse that happened and issues of decreased monitoring and what increased mood irritability. But a family approach provides a very different. This is not an individual child or an individual parent or parent adjusting and helping their children. It's actually a family approach. And where it came from was the work from Beardsley, who's done work with children with a depressed parent, where rather than the treating only of the depressed parent, actually adjustment of the whole family to recovery within that family context. There's enormous longitudinal data about its effectiveness in restoring family functioning and protecting child mental health. Dr. Lester has done a lot of work with children with HIV-positive parent, showing a family approach is actually quite protective in the next generation against adolescent pregnancy, reckless behavior, and more social adjustment and functioning. And also the work that we've done with children traumatized by war and the work that you just heard described by Dr. Yule. Let me just outline what we do. There's a session 1 and 2 where we work with the parents only. There's a session 3 and 4 where we work with the children only. There's a session 5 where we actually prepare the parents to work in 3 additional family sessions. And those are important because we review, in the first sessions, we're reviewing the parents' experience of their own about the deployment. It's not of their children. It's what military personnel who had been deployed, what his or her own experience of being deployed, of their wartime experience overseas actually had been. It's also the experience of the spouse that's remained across the Corps, and I'll show you 3 tours of duty and what happens. And they actually make a timeline of their anxieties and distress all across their experiences. Both parents do. We then do the same with the children. We actually make a timeline, as I'll show you, of actually their moments of distress throughout the different tours of duty of their parents and what the issues were for them. We then allow in session 5 to prepare the parents actually to discuss those timelines with their children and to understand what the children's vantage point and what they might say and do to assist their children in resolving some of the issues. And then to make family plans in sections 6 and 8, not only to resolve some of the issues, but also to make family plans about reminders, about problem solving, and I'll give you some examples. Part of this was based on our work that in any danger circumstance, there's going to be estrangements among family members. And the estrangements are one of the major contributors to the family distress that Dr. McFarland described many times. Even in the most loving of families, there's going to be moments of differences in estrangement. And this is really partly to address those issues. So the parent and child and the family sessions share their narratives. And these are shared. Discuss the similarities and differences, clarify their differing perceptions, challenge their problematic beliefs and attributions, develop a shared understanding of the family's wartime experience, and engage in problem solving and developing a family coping plan. This is an example. John and Laura have 3 children, ages 3, 8, and 10. The mother contacted the program. During a brief phone intake, the program learned that her husband had recently returned from his 3rd deployment. The last 2 had been involved in combat in Iraq. She reported that since his last return, he is not the same guy. Previously a patient and doting father, he's now irritable and unreasonable with the children, isolative and drinking more. The children are also having difficulties. Adam, who's 8, is fighting at school and at home, argues and won't follow directions. And Sarah, 10, appears anxious with many fears. And Micah, who's 3, is very clingy. The husband promised to get counseling on the base, but has not done so. What we found is actually providing a family orientation has brought more and more of the combat Marines into service. than they were seeking necessarily on their own. They would do it for the benefit of the family, not necessarily for the benefit that they saw for their own individual care. Let me show you a timeline. This is the deployment. There was a new baby born right before deployment. There was a training period in which he went off to actually, the first deployment essentially was to go off and train for combat for this. And there was actually very little anxiety on the part of either of the parents at that point. He then is deployed, and you can see that both parents describe this as a very distressing period. You can see their level of anxiety as they measure it there. With a painful goodbye, and the level of distress experienced by the parents, both of them were rated during the course of the first deployment. He's then there during the, he then comes home, and I want you to notice that the distress, how rapidly it dropped during the first time back from a tour in Iraq. But then the third deployment, you'll see, it says he stayed longer. What happened there was that he was supposed to be coming home, but he actually elected to stay longer as a volunteer in his tour, where everybody had expected him to come home, and you'll see that the children interpret that he might have been killed. But it became a very strong point with the wife as well, who was angry at him actually for having chosen to stay longer at that point. And then when he comes back, this is the severe child problems. The distress isn't falling at all. We have now the troops that are going through 3 tours, 4 tours. You can see the type of impact over their tours of duty during wartime. If we then add the children, this is a picture by the younger boy of the new baby arriving, and of some really sense of separation from it with the new baby arriving in the family and feeling somewhat ignored at that point. This is right before the first deployment for training. If we then put the second point in, and this is a moment of contention, this is the first deployment to Iraq. And the father, at the moment that they're at the bus where he's about to leave, feels that his son actually turned away from him. His son didn't hug him, didn't want to seem to have anything to do with him, and he interpreted that his son was mad at him. And he went off to the first tour feeling that his son was angry with him. In this family intervention, where the child gets to actually say what he felt at that point, he described that he actually was afraid of crying in front of his father. And so he stayed away from his father. He was really sad and really having a difficult time and didn't want to cry. So the two of them had a very different understanding. And resolving that moment actually caused a lot closer connection between the father and the son, even after this third tour of duty. But it had remained a point of estrangement through the entire combat exposure of this Marine. If we look at this point, I should say it, let me just go back. In the first, this probably happens, the mother tried to explain that the father was not in life threat. Wanted to say he had an office job, that he was doing other things. He was actually in the middle of the storm of Baghdad at that time. So they were somewhat misled about the level, but she was experienced and knew very well the level of life threat to her husband at that point. This is the second tour in leaving, and now the older daughter, who's feeling extraordinarily lonely at this point, very isolated, and she continued to have these symptoms. The second tour is really starting to take a toll on her in her own adolescent development. And she starts to describe this, but this was very much unknown to both parents. This was her inner perception of that. The boy starts to have fantasies and he didn't do that during that first tour, but he understood in the second tour that his father is very much in direct battle. So he's starting to deal with thoughts about battle and planes getting shot down and people getting killed, tanks getting destroyed. So inside him, he's dealing with every day with fantasies of life threat to his father and what might be happening. Again, unsupported by anybody in his environment. And the sister starts to have fantasies not only about wartime, but feeling the lack of protection of her father, starts to have dreams and fantasies about other disasters, earthquakes happening, hurricanes, trees falling down and destroying. So a sense of the the danger of her own life being much more expansive than actually the military combat itself. And this is towards the when they come back and trying to restore family functioning, but in a very difficult and awkward position. So this is the mapping of the children's, where the anxiety at the first deployment is much higher. You can see the anxiety of the children when he doesn't return just hits the top of the chart, and the anxiety during the third tour now has been elevated and has remained high for the children as well. But they actually look at this together, and it's been a very useful thing. The other thing is there's a lot of loss, and it's often overlooked. And this is from a different family. And there's almost no studies in combat veterans of traumatic grief and its impact. It's almost all post-traumatic stress. But indeed, this is from another family where the father had actually lost 3 of his closest friends, and he wouldn't associate with anyone afterwards. And he thought nobody in his family knew, but his daughter said that Sarah is very aware that he lost 3 of his closest friends and no one could cheer him up. So the issue of traumatic grief runs through military families in ways that are often, I think, go very silent and not well addressed in terms of the parent's response as a parent in the aftermath. Okay. So the issue is to appreciate individual experiences, to increase open communication and sharing of worries, to address interference of trauma and loss reminders on parenting and family life. Let me give you some examples. When returning home, you have a highly traumatized combat Marine, and when his children jump on him or try to tickle, he responds. He startles, he gets irritable, he has never been able to explain that to his children. We actually allow them to start to explain how the traumatic reminders of each of them work. He would then put on his military uniform, and the younger children would get frightened he was going to war every day. And so he could start to work with them. So we actually make a family plan about the different reminders that each family member has and how to work together to address those, even as the family's trying to recover from having had a family member in combat. And they work together to monitor interactions and maintain consistent return, so that the father now, more than he'd ever been, was in a combat mode. So he would yell out commands to the children. And actually allowed, because of this, for his wife to be a little check on him. They had a way to kind of communicate that. On the other time, she would get irritable in other ways that he could help her in terms of how she was behaving with the children. So the parents became much better at helping themselves in terms of their parenting style. And they actually started to make a program and a plan about traumatic reminders, about the challenges of the family. These are not individual plans, but they're actually family plans. And we've seen that very young children are able actually to engage in these quite well. We're now actually, it's interesting to see what's happened in the military. This is a program that actually supplements now the treatment of those military personnel who are actually at fairly high risk for combat-related stress and post-traumatic stress and depression. And actually the Department of Defense in the United States has actually decided that they want to expand this program much more widely as a complement, because they've never actually had a family approach to any of their interventions, probably in the history of the military bases in the United States. And we haven't evaluated this, but we'll have a chance to do that much more thoroughly. But we're actually starting to use this in many other settings. Those timelines have proved really a valuable, sort of improved methodology of doing family interventions. So an example from disaster in Katrina is I could show you the same kind of timeline for a single disaster, or actually a hurricane coming in Florida, not Hurricane Katrina, which actually at the point before the hurricane hit, the parents were much more worried about the hurricane and what it could do than the children. At the time the winds really pick up and it's hurricane strength, the children start to get really scared. These are families that did not evacuate. At the point at which the hurricane actually hits the home and nearby, the parents had locked the children into a closet and told them not to come out during that time. Well, people do things under danger, Dr. Yoa's expression. And the children then peeked out, and the parents screamed at the children, literally, that I'll kill you if you come out of that closet. And then everything calmed down afterwards, and they actually all survived. What the parents didn't understand is when you did a timeline, the parent yelling at the child, and I'm going to kill you if you get out of that closet, was the most distressful moment for the children, but unknown and unrecognized by the parents. But we could resolve that moment in terms of just a disaster, in terms of a single using these kinds of timelines. So we thought that this is an innovative approach to starting to do more family work, and the discussions and cross-discussions have seemed to be quite rewarding, with a number of exercises and homework for the family as a unit to do, rather than in the way we've done it before with individuals or with the parents as just complements to the family. But thank you.